Dr. Paige Church is an assistant professor of pediatrics at the University of Toronto, director of the Neonatal Follow Up Clinic at Sunnybrook Health Sciences Centre, and the lead developmental behavioral pediatrician in the Spina Bifida Clinic at Holland, Bloorview.
So today I'm going to be talking about a quick update on spina bifida. This is really an update about new guidelines that were recently revised and published. These guidelines were generated with support from the Centers for Disease Control and Prevention in collaboration with the Spina Bifida Association in the United States. The initial guidelines were published in 2003, and the current iteration that I'm going to talk about represents the fourth revision and encompasses 3 years of planning, literature review, content development, and encompassed over 100 volunteers. The guidelines for the care of people with spina bifida initially was raised in 2016 for consideration of revision. 24 topics were developed and committees were assembled. In 2017, a meeting was held to review, edit, and finalize the guidelines, and in 2018, the final edits were made and published. The guidelines provide evidence-based lifespan guidance for optimal care. The audience is intended for the United States, so there are slight variations to the care, but I would say they are highly applicable to individuals in Canada as well. The guidelines focus on topics that have a lifespan perspective. These topics include systems of care, which includes care coordination, health promotion, prenatal counseling, and transition of care to adult care. It also includes the psychosocial context for self-management, which includes family functioning, mental health, self-management skills, and quality of life. It included a topic around neuropsychology and neurosurgery. Topics included mobility, orthopedics, and physical activity, urology and sexual health, and then there were specific health issues that couldn't be lumped into another category. The specific health issues included bowel function, endocrine issues such as puberty, precocious puberty, and growth hormone treatment, skin maintenance, latex allergy, nutrition and obesity, and sleep-related disorders. In terms of new revisions or new iterations to this was the first time that antenatal counseling was added as a guideline. And that is a huge shift in and of itself, and I know Dr. Kulkarni will be speaking about this as well. And that shift really came from emerging evidence around the option of offering surgery for mothers who have a fetus affected by a neural tube defect to be considered repaired in utero. So the options recommended by these guidelines were that there be counseling around an in utero closure option, counseling around postnatal closure, which has long-standingly been the standard of care. Options included counseling around termination and also around adoption. The guidelines endorsed that there needed to be efficiency with the consultation in order to allow all options to be available. There were key components that were implemented in this antenatal counseling guideline, and those included value-neutral language. And by that, we meant that it's up for the families to make a decision about how they feel about the information they're receiving and not for us. So we strongly discouraged words such as good or bad and encouraged words such as significant or important. We felt strongly that it should involve a collaborative consultation with exploration of family values, and that the counseling had to provide a lifespan perspective in order to be adequate. These guidelines are freely accessible on the Spina Bifida Association website, which you see here. And if there are any questions, please feel free to email me at my email there. Thank you so much, and I hope the meeting is great, and I am so sorry I will be missing it.